Unlike Rob Rose's presentation, we're going to be talking about neurosurgery. And I wouldn't encourage you to do neurosurgery at home like Rob encouraged you to do the recipes. But we have a great speaker here for you today, Dr. Abhineet Chowdhary. And by the way, I've never called him Abhineet because I think maybe only his mother calls him that. We know him by Minku here at Overlake. Dr. Minku Chowdhary is a fellowship-trained, board-certified neurosurgeon who specializes in brain and spinal tumors, cerebral vascular neurosurgery, microvascular decompression, and minimally invasive spine surgery. He is an experienced neurosurgical oncological surgeon, neurosurgical spine surgeon, interventional neuroradiology, endovascular neurosurgery, and cerebral vascular disease. He's experienced across all of those disciplines. Dr. Chowdhary received his medical degree from The Ohio State University, which we will forgive him for, and did his residency at the University of Washington, which we will applaud him for. He also did his fellowship at the Atkinson Morley Hospital in London and Cedars-Sinai Hospital in Beverly Hills. Dr. Chowdhary joined Overlake in 2012 and is currently the director of Overlake's Neurosciences Institute. So join me in welcoming Minku Chowdhary. Minku, I'll turn it over to you.
Thanks again to Mike and the Rotary for allowing me to present to you guys. I'm going to do a quick introduction to neurosurgery and really modern neurosurgery, because I think a lot of this is still very much like the movies or the TV shows. And I want to show some of the new things that we can do that can really help patients get a lot better, but in a much more minimally invasive fashion, so you can return back to what you really care about, which is your regular life. So if we can go forward on the slides. So this is what people think of neurosurgery. This is an old Renaissance painting of trephination, where we thought if we just drill a hole in your head, we can let the bad humors out. Obviously, neurosurgery has advanced quite a bit since that point, and especially over the last about 10 to 15 years, we've had a remarkable renaissance of our own in terms of our technologies. Next slide, please. So this is more like the modern operating room. This shows some of the technologies we have here at Overlake. In the background there, you can see a very large microscope, and a lot of the surgeries that we do now, whether they're in the brain or the spine, are done through this microscope that allows us to magnify the field 10 to 20 times what we can see with our natural eyes. And in the forefront, we have these navigation machines that are essentially like GPS maps that allow us to map both the brain and the bones of the spine to help perform our surgery safer and faster. Next slide, please. And in the past, there was the bigger the surgery, the better it must be. As time has gone on, much like in most fields, consumer demand has driven a much less invasive approach to treatment of these disease processes. So if you go forward there. So this was the old way, and if you go forward, you'll see the new way. So these are the new smart cars we have. These are in case you decide to go down to Capitol Hill, they'll get you out of there safely. Go to the next slide. And to the next slide. Keep going. And to the next slide. So they've shrunk the neurosurgeon down so that we can perform these minimally invasive surgeries. Next slide, please. Forward. And so these are some of the disease processes that we can treat. As we get older, there's a condition where we build extra water on the brain. And for some people, especially once they reach their 70s and 80s, this can affect your ability to walk, your short-term memory, and even continence issues. And before, we had to drill this hole in the head and put a hole in the abdomen, snake a tube from your skin all the way from your head to your abdomen to drain this fluid. Now we can just do it through a single hole and a little camera inside of the head. So obviously a lot less invasive for the patient, and nothing mechanical goes inside, so less incidence of things breaking down. Forward, please. And that's what that camera looks like. And where it's shining that light at the end, we can poke a little hole in that membrane, and it allows the water to go through a different channel so that these symptoms of memory loss and walking get better in our older patients. Next slide, please. And the next field is really brain tumors, and we've really gone away from doing these big surgeries where we would have to remove a large portion of the skull to take out the tumors, and we're starting to do them a lot less invasively through endoscopes. For some tumors in the front of the head, especially the pituitary gland, we can actually just stick a camera up one of the nostrils and operate through there. Next slides. And this is the old way where we had to put instruments up through the nose, and if you go forward, please. And here's an example of a very large tumor. I've highlighted it as the orange in the top right picture. And just going through the nose with a camera, we're now able to remove all of that tumor, which is about the size of a plum, just through the nose. Forward, please. Overlake's had the advantage with the amount of technology and innovation that we have in the area of new technologies that have come to light to make tumor surgery better, safer, and faster. And this is a great example of a local company that came up with a product that attaches to tumor cells and makes them glow. And using a special UV filter on the microscope, we're able to remove now the tumor and see it under the microscope. Our breast surgeons have been doing this as well for breast cancer, which has allowed them to get much better and safer resections in the meantime. Forward, please. And the next step, which we're just delving into here at Overlake, is now going to be augmented reality surgeries, where we're able to overlay the patient's imaging on top of them live, and that'll allow us to see the anatomy even clearer, and which allows for a safer surgery and a better outcome for the patients. Forward, please. And forward again. And so these are some of the new technologies that we have that allow us to do this navigation or GPS guidance for our surgeries, which is much more precise than the older way of just using anatomical guides. As we know, not everyone is built the same way or has the same distances between critical structures. Forward, please. And this is a new technology that just came out about 5 years ago that we've been trying to incorporate. And what these are essentially are little tubes that we can put into the brain to remove tumors. And actually in that top left picture, you have all of those colored fibers that look like threads. All of those threads have a specific function, and where this one is going specifically, that is in front of that tube is the part of your brain that makes you move half of your body, and behind the tube is half of your brain that makes you feel half of your body. So now with these minimally invasive techniques, we're able to get in between these critical structures safely. Next, please. And here's an example of someone who came in with a hemorrhage, which is what that white is in both of those pictures on the left sides. And using that tube, we're able to put in a port and evacuate that hemorrhage from the brain through a single hole. And this patient gets to go home the next day instead of being in the hospital for 7 to 10 days and then having to go to a rehab facility afterwards. Next, please. Likewise, we're going to have some technology coming in the near future that allow us to, for lack of a better word, have pacemakers for the brain for various things such as movement disorders, Parkinson's disease, the shaking that comes from that. And actually the newest technology is able to treat things like OCD, obesity, and severe depression with these neuro pacemakers that allow us to override some of the signals in the brain that result in those problems. Next, please. So this is the big thing that we've been doing over the last 8 years at Overlake, which is we've moved away, and I apologize for the bloody picture, from doing these big open surgeries for blood vessel problems like aneurysms and strokes, and now we're able to do it in a much less invasive manner. Can you go forward, please? So back in 2001, we came up with a little device that had a corkscrew on the end, and this allowed us to try to fish out these blood clots that were causing these disabling strokes. And as technology advanced, next slide, please. Can you go forward, please? Then we have these suction devices that allow us to suck out the stroke as well. And what we did was then we combined the two technologies. Next slide, please. with these retrievable stents that we're able to put in to restore the blood flow to the brain, but pull out the stent when we were done so that the patient would not need to be on blood thinners afterwards. Next, please. And these are some of the newer devices that combine the two technologies. These technologies now, we're incorporating that suction device as well as the corkscrew devices simultaneously. And now the success rate is around 90 to 95% versus 50% originally of removing the blood clots. Forward, please. So here's some examples. I can show you all these slides, but it doesn't really mean anything unless you really relate it to a patient. If you can go forward, please. And forward again. So this is a patient who's relatively young, 46-year-old, father of 3, came in and he couldn't move half of his body, which is, as you can imagine, very disabling. And traditionally, all we could do was provide supportive care. Now we're able to go up through one of the arteries in the leg and remove this clot. And can you go forward, please? And here's a picture. Can you go forward 2, please? Forward again. Forward. And one more. One more, please. And one more. So in this picture, you can see on the left side that there's all of these blood vessels that are missing. After we remove the blood clot, which is the right side, you can see all those wiggly lines that you couldn't see before on the left side of that picture. And these are the blood vessels that control movement, memory, and speech. Can you go forward? And that little guy was causing all of those problems. And that's a retrievable stent that we use to pull it out of a blood vessel that's about 3 millimeters in size. Can you go forward, please? Likewise with aneurysms, before we had to cut the head open, put these clips on the aneurysms. Can you go forward again? And forward. And forward one more. And this is what those incisions look like. You could see that briefly, but now we're able to go through the leg with a catheter all the way up to the head. And what you don't see in that picture is you don't see any blood. So that's how we've moved away from these open surgeries, all now done through an IV. Forward, please. And forward. And on the right side of that picture, that's the size of the incision. It's really not an incision, it's just an IV hole. And that's a patient who's quite pleased that she gets to go home the next day instead of spending 3 to 5 days in the hospital and getting a fancy haircut like myself. Can you go forward, please? And this is what we do with these aneurysms is we can go inside of them and we can fill them up with coils, which blocks them off so that the patient doesn't have to suffer with that open surgery. And forward again. And these are some of the new technologies we have. There's balloons that we can use to make it safer. There's glues, there's little stents. So all of these things have come up over the last about 10 years. And over the last 3 years, even these have been further refined to a safer and faster form. Forward, please. And forward again. Forward. And this is an example of an aneurysm, which you can see in the picture as that round balloon in the middle picture. And in the right picture, you can kind of see these little silver coils in there. And that's how we fill the aneurysm up from the inside. And this patient doesn't have to worry about brain bleeds at this point. And if you can go forward. Forward a couple more. These are some blood vessel problems where the arteries and the veins, they abnormally connect to each other. Similar to if you had your water main connected directly to your toilet. When you flush, you'd have an explosion of water. Same thing can happen inside the head, except they have bleeds. If you can go forward, please. And this is what it looks like when it bleeds and the patient doesn't make it. This is a post-mortem brain slide. Can you go forward? So this is an example of a 17-year-old kid that had a pretty large one of these AVMs. You can see this is his actual skull. You can see the size of it relative to the size of his skull. Can you go forward, please? And that's where it's located, just above and behind the eye. Forward, please. So this one, traditionally, when we took it out, looks like this. If you go forward, please, and one more. That's what the incision would look like. And you can imagine as a 17-year-old having an incision like that versus, a 50-year-old having an incision like that. It's just a long time to heal from this sort of process. Can you go forward, please? And forward again. Now, using that same technique through the leg, can you go forward? We're able to fill up that black area with glue. So we actually block up these abnormal channels from the inside. Can you go forward one, please? And you can see in that right picture, that big black blob you see in the left picture is now gone. And this patient gets to go home the next morning with no incision on their head. So they're obviously much more pleased about that. Can you go forward two, please? And one more. And these are some other examples of ones that we treated that same way here at Overlake. Can you go forward, please? And one of the things that a lot of people don't realize that we have at Overlake is we actually have a pretty advanced radiation team. And they use a LINAC-based system. We've heard of things like Gamma Knife or CyberKnife, which some of the other local hospitals have. I always tell patients it's like Coke, Pepsi, Dr. Pepper. They're all versions of soda, but they all do the same thing. And the one we have at Overlake, we're able to get very precise radiation to very small areas of the brain, which allows patients to not even have a surgery in the first place. So, someone asked a question of, can I speak to the advancement in the treatment of progressive strokes, for example, hemorrhagic strokes? And the short answer is yes. And we're going to talk about that over the next few slides, which is how to prevent those strokes. And then two, in terms of that treatment, which is the hemorrhagic portion, how we treat those both with the coiling as well as with that little tube to remove the hemorrhages. Can you go forward, please? And forward again. One more. And this is a patient who had strokes from a narrow blood vessel, which you can see kind of in the middle screen on the left. And after we're able to, like in the heart, put a little balloon in and open it up, this patient now no longer has any advancement of his strokes, which is obviously better for them from a functional standpoint. Can you go forward, please? And forward again. And forward again. So this is someone who has a very narrow carotid artery in their neck. Traditionally, what we would do is we would cut the neck open. We would find that artery, we'd open it up and kind of scrape out the clot. In this picture, what you can see is we actually put a stent in, which is on that right picture, which opened up that narrowing, once again with no cuts on the skin, all done through an artery in the leg. Can you go forward a few slides, please? And one more. And this is the difference. There's a cut on the left and then forward one more. And now with this minimally invasive design, can you go forward, please? There you go. So no cuts on the neck going forward. Excellent. Same is true, with spinal fractures. In fact, if every few seconds, if you just want to hit your space bar, I'll talk. That way I don't have to interrupt. This is an older woman who had a fall, had a broken bone, which you can see on the left. We're able to just through an IV, stick some cement into there, and that takes care of her pain. And just like lifting up sunken concrete, we're able to lift up the broken bones through this minimally invasive fashion. Forward, please. Likewise with spine surgery, this is the traditional scoliosis surgery, which is huge. You can see the picture on the right. This is now our minimally invasive surgeries done through a tube about the size of a quarter. Obviously, the patient has a lot lower downtime. They get to go back to work within a couple of days instead of many weeks, which for a variety of reasons is better for them. Forward, please. And keep going forward. So here's someone's back that you may recognize. That's Hulk Hogan's back. He actually had a 9-level fusion in his back done through those small incisions on his back. And, he went from not being able to walk and now is walking again. Forward, please. Forward. Perfect. So, neuroscience is actually a rather large area of medicine. We have an excellent neurology department here, including management of headaches. We since a lot of you are business owners, for those employees or yourselves that get migraines that are debilitating, you're able to come in. We're now able to infuse a medicine through an IV that helps ablate that headache that day, so you don't have to be out of work for many days, which of course increases productivity. We're going to continue to develop our spine program with more complex spine procedures done during this minimally invasive way. Our brain tumor program is already expanding. As many of you know, at Overlake, we've now partnered with our cancer center with the SCCA, which gives us access to even more studies than before. Can you go forward, please? And our stroke care is actually, we're as good, if not better, than anyone else locally, based off of our outcomes data. At this point, you have 24/7 availability for both hemorrhagic and ischemic stroke at Overlake, so you're able to come in at any time and get your problem taken care of. So going forward, these are the sort of technologies that will keep yourselves and your employees as productive and functioning at a much higher level than we were able to before. And can you go forward 2 more slides, please? And 1 more. So these are some of the awards that we've won here at Overlake. We've actually now we have it for 2018 and 19 for stroke care excellence. We're ranked among the top 10% in the nation for treatment of stroke. We've had no deaths in any brain tumor operations. And we actually have one of the shortest length of stays. A lot of people don't realize, most of our brain tumors actually are able to go home the next day with some of these new minimally invasive techniques versus having to spend, a few weeks in the hospital. Forward again, please. And forward 2 more, 1 more. So I always close with this slide because it's I think, very apropos to our situation. You can pretend you know how to do anything other than neurosurgery. So I think we have a great team here at Overlake, and we're very happy to take care of our Bellevue community. So it's a good time for questions if anybody has them.
Okay. Thank you, Dr. Chowdhary, for your informative presentation. We are making a speaker's gift in your honor, a donation to Harvest Against Hunger, which provides 1,500 pounds of fresh fruit and produce to food banks in the area. Thank you so much for your time and the presentation today. Next week's program will be Rotary District Governor Kathy Gibson, and she's going to give us an update on what's happening in our district, District 5030. So that's it, and we want to thank our helpers here for today, Jeffrey Van Gogh, pulling the technology together, and Louisa helping him, as well as Steve McConnell for providing the space here, Jim Hogue for doing the pre-meeting social. Thank you all for joining us today. We are adjourned.